Hey there, future nurses. This is Dr. Knight, your DNP nurse educator and mentor. Today, I want to talk to you about the top 10 common struggles that nursing students face during clinical rotations and how to overcome them with confidence. You see, the nursing clinical environment can be challenging, overwhelming, and just sometimes downright anxiety provoking. But I'm here to tell you, you're not alone. We have all felt the same way that you're feeling, anxious and nervous about clinicals. Right now, we're going to get into breaking down those struggles and how to overcome them. Now, the number one common struggle that I find with nursing students is they lack confidence and they have a fear of mistakes. Now, it's very important that you guys understand that the clinical environment is set up as a learning space. You're there to learn. And you must recognize that mistakes are opportunities to learn. They're not failures. They do not define you. They allow you to learn and grow so that you can become the confident nurse that I know you guys all want to be. So starting right now, you need to view your clinical rotation as an opportunity or space for you to learn. You're going to learn, grow, and you're going to keep it moving. Another thing is make sure that you remain open for feedback. Your clinical instructors will be there, preceptors, and the experienced nurses working on the unit. We are all there to help you. So remain open to the feedback, and I assure you, you will grow into being a competent registered nurse. Number 2 is time management and prioritization. Now, this is a big one. There are so many things happening in the clinical environment. The nurse has to deal with multiple tasks. And sometimes we present ourselves with a to-do list. But you have to know how to prioritize. Prioritize. What do I do first? Who's unstable? Who do I need to see right now? And the best way to do that is to use a framework like ABC, airway, breathing, circulation. If you use this framework, it will help you determine what to do first. For example, if you have a patient that is experiencing difficulty breathing, a shortness of breath, and you have other patients, one might be asking for water, another call, I need to go to the bathroom. You have patient families there, they want your immediate attention. Which one do you do first? Of course, you have to address the patient with difficulty breathing and perhaps delegate a nursing assistant to help the patient with water and the patient to go to the bathroom. Or even a clerk can help call a doctor for the patient family. So remember, priority is number 1. What do I do first? Use the framework ABC, airway, breathing, circulation. And this will help you with getting organized and prioritizing and keeping your patients safe. Number 3 is clinical judgment. Now, this one is a big factor for nursing students, new graduates, and for some nurses right now working on the clinical unit. We have been operating specifically with tasks because we have so many things to do. We need to do X, Y, Z. But we have to now rethink and realize that we need to be looking at the whole picture of the patient. What is happening to my patient? So when you take vital signs, you need to be monitoring trends and patterns. What is happening to my patient? So look at the vital signs starting from 8 o'clock in the morning, maybe until 12 o'clock. Is my patient getting better or is my patient getting worse? And what do I do immediately to prevent my patient from deteriorating? What interventions do I put in place first? We're going to have to start looking at the whole story. So when you see a patient, you need to connect all the dots so that you're able to intervene as soon as possible. Early intervention prevents patients from deteriorating. That's what we're going to be focusing on in clinicals. It's a new concept that you're going to be hearing during lecture, during clinicals. You're going to be hearing it from all of your clinical instructors. But do not worry, we're going to be guiding you through this process because we now have to retrain ourselves to think about the entire story of the patient and what we're going to do to keep our patients safe. Number 4 we have here is communication and SBAR. Another major issue in the healthcare environment is communication. You see, lack of communication or poor communication leads to adverse events, and we do not want that to happen. We want to make sure we are communicating effectively all the time. So what they have designed for us is something called SBAR, Situation Background Assessment and Recommendations. This is a framework that's going to guide your thoughts. It's going to keep you from rambling and freezing up when you're trying to speak to a doctor or any other healthcare professional. We're going to teach you SBAR, so don't get so overwhelmed. You're going to learn how to hand off to your primary nurse. You're going to be handing off to your instructors what happened to your patient. So this is something you're going to be learning. If you're not familiar with it, take the time to look it up right now. SBAR, Situation Background Assessment and Recommendation. It's a process that's going to help us keep our patients safe. Number 5 is skills and anxiety. Skills anxiety, meaning that a lot of nursing students, they have anxiety about what they do not know. Like they don't know how to take a blood pressure, take pulses, auscultate lungs, things like that. But I'm here to tell you that it takes practice. You start as a beginner and then you grow into being a master at those tasks. What I recommend is that you practice and you practice. You might get nervous when your professor is looking at you, but open yourself up for feedback and she will guide you through the process. And over time, you will become so confident in that specific task that you can do it no matter who's there. Patient, family, instructors, doctors. The goal is that you practice until you reach mastery. Number 6 is unit culture. This one is a doozy because when you arrive in the clinical environment, you're going to realize that most of the healthcare team is just going about their everyday tasks. This is what they do every day. And this can sometimes make you feel as if they are ignoring you or they don't want you there. It can even make you feel like you do not belong. But I'm here to tell you that you belong. You belong in the profession. Don't let this distract you or make you feel like you want to give up. I'm not going to let you give up. You need to realize that you are part of the team and it's going to take time for you to just adjust to that unit and that culture. And I'm here to tell you that as we continue to be on that unit, you will learn how that unit functions. You will get comfortable working with your instructors, the primary nurses and nurses aides, and you're going to be just fine. Just do not give up. That feeling will disappear over time. We are up to number 7, balancing life and clinicals. You see, a lot of you are working, you are in school, you have family lives, and this can be very stressful. But from experience, I'm telling you that you must make sure that you take care of yourself. You are number 1 here. Nursing is a very giving profession. It can actually deplete you because you're constantly taking care of other people, and we often forget to take care of ourselves. So I want you guys to start right now as nursing students. Make sure that you are eating better, healthy, choosing healthier foods, you're drinking plenty of water, and you're getting good sleep. Enough sleep. You got to sleep well, guys. You need to do these things so that you can replenish. It's like filling up your cup so that you can pour into someone else. When you do these things, you're going to feel a lot better, and you're going to be able to provide better care to your patients, knowing that you took care of yourself. So just remember, work-life balance is important. Take care of yourself, spend time with your families. This way, when you come into the clinical environment, you have something to give. You're not depleted. Remember, take care of yourself first. Number 8 is documentation challenges with the I always get twisted, the electronic health record or the medical record, whichever one you want to say. Most of you guys are used to technology by now, and the medical record is all computerized now. What you have to do now is just learn where things are and where to find things in the medical record. And you will be able to do that over time. What I do recommend is that when you see a nurse working on the unit, make sure you ask her, can you observe her documentation when she's writing notes, when she's updating her care plans, or even when she's looking up labs, x-rays, whatever she's doing, see that you are able to observe. And this way you can see how it's done. And another thing you can do is make sure that your clinical instructor is showing you the electronic medical record. She will show it to you, and you will be able to navigate where things are. And over time, like anything else, repetition, that chart will become so easy to navigate. So in the beginning, you can't find where things are, but for sure you will. I remember for me, we went from paper charting. When it was a paper chart, we had to write everything. When we first transferred over to the electronic health record, it was challenging, but we were able to do it. Right now, you guys are blessed because you all have technology and you're pretty much used to it. So you just have to learn what things are, and it will take time to do that. Number 9 is emotional toll of patient care. Now, this one is a biggie because most of you have not experienced a patient dying, patient trauma, or patient suffering. So when you first see this, it can take an emotional toll on you. It can be actually draining. But I want you to know that it's not a sign of weakness. It's actually normal. It's human that you feel this way. I'm going to recommend that when you do witnesses, that you make sure you participate in a debriefing with your instructor and your colleagues. You need to sit down in a group and have a discussion over how you are feeling or how it made you feel, and then discuss how you can handle it better the next time. Debriefing, it's a process that helps us, relieve some of this emotion. And I want you guys to leave this emotion in the clinical environment. Do not get in the habit of taking all this emotion home. It can be draining. So make sure that you are debriefing with your instructor and your colleagues, and you will be able to process patients dying and suffering, and sometimes the traumatic experience. You will be able to deal with that a lot better. You can't avoid it because it's going to happen. It's a normal process. Death is a normal process. And sometimes as nurses, we have to ensure that the patients are able to die with dignity. But you will learn this over time. Don't worry. We're going to get you there. Okay? The last thing is moving from lecture to clinical. Integrating it all. This is when you really start to feel like a nurse, because you're learning about all of these disease processes from your lectures. And then when you come into the clinical environment, you really get to see it. You get to witness the signs and symptoms of heart failure. And you get an opportunity to just picture it all. You see the whole story, and you're able to provide the right interventions because you've learned about it. And it just makes you feel so great. So over time, you're going to realize that when you see something, you can almost anticipate what is happening to your patient and what you need to do to keep this patient safe. So in summary, guys, here's what I want to remind you. You need to just understand that the clinical environment is a learning space. It's opportunities for you to learn and grow and become the professional nurse that you guys all want to be. Starting right now, just say it's a learning space. Make sure you guys open up to receive feedback from your instructors. Don't take it as she's picking on you. She's actually helping you grow so that you're able to provide better care. The tasks that you're having anxiety about, as you continue to practice these things, you will get better. You will get better each and every time you show up to clinicals. Just make sure that you are showing up. That is critical. Show up, participate, and be engaged, and you will be able to just navigate all these struggles and become a better version of yourself and a better registered nurse. So right now, guys, if you like the things that you have been hearing, I need you to click the like button, subscribe, and make sure you watch my upcoming videos, or you can even go back and watch some of the other videos that I have on my channel. So right now, I'm going to say thank you and happy clinicals.